guys, it's Caitlin from All Care Physiotherapy. Just got another exercise to help increase the strength of your quads and your leg muscles to help decrease knee pain. We often use this exercise here at All Care Physiotherapy. So we've got Pat here, to help demonstrate the exercise today, and we're going to do what's called a squat, okay? So what Pat's going to do is imagine he's sitting back onto a chair. He's going to bend his knees, really keeping in mind that he's got to keep his knees over his toes and they're not moving inwards. And then he's going to come up. We're going to go down again just as far as he comfortably can go, and then coming back up. So this is a really nice exercise for getting your quads working eccentrically, which is helping to control your movement, and is very useful for exercises such as going down the stairs in your everyday life. Today we're just going to be discussing some of the main things we see when people are trying to do squats, which can often be contributing to their knee pain. So I'm just going to get Pat to do a squat as he thinks he should. Okay, so you can see that Pat's knees have gone inwards, so we'll come up. Pat, this time I want you to think about keeping your knees in line with your second toe, so they're trending outwards rather than in. Good, and coming up. This just improves the hip-knee posture, okay, and puts less stress on your knee joint.